Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Diseases we thought were gone, mostly gone or under control by vaccinations, are making a comeback. Over the past decade, vaccine-preventable diseases have gained a new foothold, posing a threat to our country's population health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Today we talk about the effects of the anti-vaccination movement. Stay with us. We'll be right back. Welcome back. Though vaccination has led to a dramatic drop in cases of certain contagious diseases in this country, vaccine-preventable infections are still a threat to us and our communities. Joining us this morning is Dr. Greg Holzman and Stacey Anderson from the Montana Department of Public Health and Human Services. Thank you both for being with us.
Thank you.
Thank you.
I'm going to start with you, Dr. Holzman. Can you tell our viewers about your credentials? What kind of a physician are you?
Oh, I hope a good one, but I'll add in what credentials I have is I've actually done 2 residencies. I'm boarded in 2 areas. One is in family medicine, and one is in preventive medicine, which is a lot of public health, and got my master's in public health through that residency program also.
Excellent. How long have you been in Montana?
This time around, it's just about 3 years.
Okay.
My first job out of residency, from my family medicine residency, was actually on the Blackfeet Indian Reservation. That was the first time I'd ever touched foot in Montana.
Excellent. Thank you. How about you, Stacey? Talk about your background.
So I have a background in microbiology, which is contagious disease and the study of those diseases. And then I have a master's in public health as well from Westminster College in Utah. And I've been in this position for about 7 years now.
Excellent. All right, now I'm going to switch back to you and ask you to talk about vaccinations and why are they so important?
Yeah, a lot of times when I talk about this, I like to talk about the history because it's just so amazing when you look at this. And I can give you a lot of numbers. Let's use measles as an example. If you look at measles, the number of cases in the United States before the measles vaccine was about 4 million a year. And then the measles vaccine came around in 1963. Or if you look worldwide, it was estimated that there was about 2.6 million deaths a year from measles prior to that vaccine. Sadly, that vaccine has not gotten all around the world, and we haven't gotten the immunizations as well as we want. But the deaths from measles has decreased quite a bit, and it's down at 80 to 90,000 a year. So still a lot, but it kind of lets us also here in the United States, where we rarely see measles cases, to understand that this is a serious disease. And I could give those kind of statistics for all sorts of different diseases and what a difference that vaccines have made in that. What I would say is, as seeing the decrease that has happened, I often like to tell stories along with it because the numbers sometimes get hard to understand when you're talking these kind of things. And I think about oftentimes my grandparents who were born 1890, my grandmother was born, and my grandfather was born, and a grandfather and grandmother on the other side in 1908 and 1905. Their average life expectancy at that time was 47 years. That was at the turn of last century, going into the 20th century. By the time we got to 2000, the average life expectancy in the United States was 78.1 years. You have this huge increase, and you think about, well, that's because all these things that happen in medicine. We got antibiotics, we could do better surgeries, we have insulin now that wasn't around beforehand. But actually, when you look at the data and everything, about 25 of those years are due to public health. And the CDC put out this great, CDC is Centers for Disease Control and Prevention, put out this great tribute at the end of last century called the 10 Greatest Public Health Interventions in the last century, and that had the effect on that. And vaccines is one of those. It's a big one in there. There's things from workforce, decreased workforce injuries and deaths, and the numbers are very inspiring to see what a difference that made. Vaccines are probably two things. One is the control of infectious disease, so that we got much better at trying to decrease infections, like with refrigeration and just proper hand washing, pasteurization, how many deaths happen from outbreaks from unpasteurized milk prior to that, these type of things going on. And then to get the immune system to get your own body to fight a disease before you ever get exposed to it. And that's where we see some great changes with vaccines. And you see things where you see numbers of measles cases decreased by 99%. Or even something in my lifetime has been the Haemophilus influenza vaccination that has gone down a 99% of decrease in those infections. Or some diseases that we don't see anymore at all in the world, like smallpox, or even in the United States, like polio, and hopefully getting close to eradicating that in the world, but still struggling with a few countries where it shows up.
Yeah.
So made a huge difference. And I could go on and on that. Yeah.
That is amazing.
Yeah.
Well, let's switch to Stacey. And Stacey, can you talk about how vaccines change the landscape for communicable diseases in Montana?
Sure. So a good example to kind of take from what Dr. Holtzman was saying is looking at mumps. Mumps is one of those communicable diseases that is currently protected by the MMR vaccine. Measles is one of the other components. Mumps is generally sort of considered a child, or was considered a childhood disease. It's usually pretty self-limiting in that you recover fairly easily, but can have some side effects and some consequences, including things like deafness and an inflammation of the brain. Very rare, but it can happen. Prior to the introduction or the recommendation to give that dose of MMR against mumps, we would see hundreds and hundreds of cases in Montana. And then within the first few years after that first dose was recommended, the number of cases dramatically fell. And then once the recommendation was given to add a second dose of MMR for all kids, it even fell even smaller. We have very few cases since then, pretty much sporadic activity. Every once in a while you'll see an uptick of these things, but generally speaking, it's had a significant impact on the number of cases that we've seen in Montana in the intervening years. Another example that Dr. Holtzman mentioned was Haemophilus influenzae. This is another bacterial disease that affects babies. Since the introduction of that vaccine, we've seen very, very few cases. So it's been a positive impact.
Oh, that's wonderful. Great. Well, we need to pause here and take a quick break. But coming up next, how did the anti-vaccination movement start? And are there really risks associated with the MMR vaccine? We'll talk about that and much more right after these messages. Stay with us.